Right, thank you. Good evening, everyone. We just quickly try and go through this important topic, dementia. Thank you, Annie, for the brief introduction. We'll try and keep it very short, and we could reference this later on and go back because there is a lot of detailed information that we won't be able to talk about, within the time allowed. Now, I'm presenting dementia, and look at this man. Thank you, Annie, for the picture, because Annie did a lot of work here as well. We work together. We did this all together. So this man shows a typical example of someone, a dementia patient. So it's a psychological condition. It's not a disease itself. Dementia is not involved. What leads to dementia are the disease that could lead to someone having dementia. So it's a psychological conditions, and it affects people's memory, cognitions. And these are very important things that we need to perform our daily activity. So when the people start losing their memory, you can imagine how frustrating that could be. So that man is just like, goodness, he's losing his memory and there's nothing he could do about it. So let's move on as quickly as possible. Yeah, to the next one. So we show an example of a slide, a healthy brain and an Alzheimer brain, which is a common type of dementia. The healthy brain, you could see the size of it. It's big. The Alzheimer brain has shrunk, and then you could see the convolutions as well. The Alzheimer brain, there's a lot of gap. It's so widened, and it's just disease. It's not normal. It's losing all the gray matter. We go on to the next one, please. Now, so dementia patients, strictly, there are things that you notice in some people, like their personalities. You find out their thinking, like you mentioned, complex attention. You now wonder why people retire at certain age. They will now say, all right, because you're losing these thinking abilities, handling complex situations and things like that. Sadly, these things happens. Part of dementia as well that we use is old age, as senile dementia. That's the one you get with old age, not the bad one itself, but it's accepted that as you get older, you start losing your cognitive functions. Now, let's go on, please. All right, the symptoms, it's all the same. The person started noticing that, he's forgetting short-term memory, people's name. You meet someone, you have a meeting with them, and you can't just remember their name or recall certain things, very important things from the meeting. They have to take notes and things like that. So that's the first symptoms that they start getting, which is a short-term memory. And then, when we talk about things that you normally do, this person is, familiar with things that they do, and they are now struggling to do their task. They're struggling to get things out, so it progresses, and reasoning become a problem. It's just like modeled and becoming different person. So they classify that into cognitive symptoms, which is using the brain, and then psychological symptoms. The person becomes, kind of having some, different character. I'll give an example. There was a chap that the wife found him dancing on the street, and the wife now that's not my husband. Why would you be dancing middle of the street? And these are things, you start seeing a different character, they become a different personality and different kind of person. Those are the psychological elements of it, a brief of it. So let's go on, please. Yeah. And there are various types. The commonest types is the Alzheimer's disease, and then followed by the vascular dementia, the Lewy body dementia. In that order, those are the 1, 2, 3, and then you have the other ones. But the common one is the Alzheimer's type, which could happen at any age. They've seen it in people as young as 50, 45 with Alzheimer's dementia. That's a very sad one because it has a genetic component to that. So I know we're going to talk about prevention. How do you prevent something that you have the genetic tendency to, you're programmed to have Alzheimer's disease? Well, there are things you could do, but Alzheimer's it's a horrible one. It has a genetic component. And then we have the vascular dementia, which is preventable, because that involves our lifestyle, how we manage our health. Yeah. Okay. Right. I don't want to go into the details of the vascular. The brain is full of wires. They are neurons, and they connect and talk to each other. It's not a long, like 100-meter wires. They are like short strands, and they have a kind of connections. We call synapses. They talk to each other. When there is a problem in this pathway, there's a disruptions, then they are not talking to each other, and there's a problem. Now, what causes this short circuiting? The proteins, the bad proteins. Some of them are called amyloid proteins. Those proteins are quite harmful. They are denatured. They are dead proteins. And when these proteins becomes around the nerve fibers, they disrupt the transmission of information from one nerve ending to the other one, and then there's a problem. And that's basically what's happening in dementia cases, whether the Alzheimer's, but in the vascular type, what is causing the disruption is people with uncontrolled hypertension. We've talked extensively about hypertension here. To have a very good control of your blood pressure is very vital, because if that's not happening, then you are damaging those blood vessels that supply those parts of the brain. The higher the pressure in the lumen of the blood vessels become thickened, they become weaker, and they become fragile. And when that happens, they start having some microbleed. And when they are doing that, so you're not even aware of it, you are killing some segment of the brain. And that's what we call vascular dementia. And that's due to high blood pressure, uncontrolled diabetes, and our lifestyle, our stress level that is not being properly managed as well. That we can definitely prevent. And then we talk about Lewy body dementia. That's just talking about all that, the protein clumps that we're talking about. And this is found in most people with other diseases too, like Parkinson's disease, Huntington's chorea, which we can talk about at another forum here. Okay, thank you. Next. Right, so this is a part of the brain that could be affected with dementia, the frontal part and the temple. The frontal part of the brain is our personality. It determines how the inhibition, you decide, you make decisions on what is right and what is wrong. Once you lose the frontal lobe, we're in trouble. That person becomes mad because he can't just understand basic rules and everything anymore. They just become a different person entirely. And the temporal part of the brain is where the complex task, when you logical reasoning, that's where that is. Where you could see those important areas. They are very, very vital. Now, it's nice to talk about this one. The frontal temporal part, when they are damaged, that's a bad one. Now, how do you improve this one? We talk about the prevention of things like this when we start talking about the prevention. Yeah, that's good, because this can be prevented as well. So we've talked about Huntington's disease. These are inherited diseases. It's passed from generation to people, and when people have that, then they are prone to have dementia. But like I said, these are things you cannot really do much about. Next one, please. Parkinson's dementia, yeah, that's same thing like Huntington's. In Parkinson's disease, there is a damage there is a nuclei in the brain, thalamic nuclei. When there's a damage to that nuclei, then there is a loss of substantia nigra, which control our extrapyramidal tract, the way you use your hands, the way you walk around, the way you talk. So in Parkinson's disease, you see people with tremor. They present with tremor of the hand, and it's called resting tremor, not intention. They're sitting down and their hands are shaking. There's a difference between when you try to reach out for a pen and then you're having a shake. And there's a difference that when you're just sitting down, you're just shaking. So tremor is one of the first things you see in Parkinson's disease. And then the next thing they have is poverty of speech. They can't really talk properly. And then they start having problem with movement, initiating movement. So they shuffle. They just move a bit and then stop, move a bit and then stop. So it's a triad of those things: tremor, shuffling gait, and poverty of speech. So when people develop that, they develop dementia as part of the presentation as well. Thank you. Next. And then there's a mixed dementia. Mixed is like everything. It can be bad enough. People already have genetic predisposition to have dementia, and then they now have the vascular element as well, blood pressure, diabetes, and they probably have other diseases like Parkinson's, all mixed together. So if you're trying to prevent one, the other one is coming in. So that's a very bad one. Yeah, mixed dementia. Okay, thank you. And everything we'll be talking about. So we know that Alzheimer's could cause it, Huntington's, Parkinson's, multiple sclerosis, depression. Can you imagine depression leading people to dementia? So you could imagine what depression could do anything. Depression, brain injuries, definitely, people who had a stroke or brain tumor. Once there's a problem, like we said with the neuron, those things could lead to dementia. Alcohol causes dementia, no doubt about that. It's quite common, the severe type, in the people who are alcoholic. When they are alcoholic, they lose an essential vitamins that the body needs, vitamin B12. Once you don't absorb vitamin B12, they die. And when they start dying, that leads to dementia. And there are two types of dementia we have in alcohol people, named after some German and Swedish professors, Venix and Kosakov. Venix, if you catch them quickly that they have Venix, you can bring that back. But once they reach Korsakoff, that's the end of it. It's irreversible and it's terrible. And Korsakoff, people with alcohol, they don't even know they have that Korsakoff until late stage. When they have it, they become liar. Not they're lying deliberately. It's because they cannot remember how to put things together. An example is you ask them, you say, oh, do you know anything about this tree? The tree in front of their house. Oh, that tree was planted by my grandfather. It wasn't planted by his grandfather, but he needs to tell you something. He could not stop himself. So it was planted by my grandfather. Ask the person 2 hours later, who planted that tree? Oh, my wife and I. I just start hearing different things. And that's Kosakov. And they start wondering, what's going on with this man? And it's a horrible, horrible illness, but people always diagnose it late. When it's too late, they're about to die, and then you see they have Kosakov. They've had drinks all their life. So we need to be very careful. Those are preventable things. We talk about that later. And then the next one is substance misuse. Things that we do, substance misuse, drugs, heroin, cocaine, stimulants, amphetamines, they all have effects. Marijuana, cannabis, terrible effect on the brain. It's fantastic medicinal, but it has a devastating effect on people's brain as well. Okay, and then the risk factors for dementia, they put it there, age, we get older. So the natural phenomenon, we've discussed that here. We're not designed to be here forever. So if you're lucky, you have a good run. If you're not, you start getting to a certain age, it catches up. So the risk factor is age, which you can't do anything about, you begin to age. And then your ethnicity, nothing you can do, you are coded, you have ethnic background to predispose to dementia. So now in that sense, they were quite silent about that. In the reason being that there are many factors surrounding ethnicity. Now we have our stress. We know that that hypertension, diabetes is predominant in this group that we're talking to now, this audience. So that's something that turns out to vascular dementia on its own. But when you talk about the other ethnic groups, they are probably more prone, like people that live in the temperate countries, that were born in the temperate climate. They are prone to multiple sclerosis. Multiple sclerosis, MS, a debilitating neurological disease. So you cannot say one ethnic is more prone to the other. So we are all our own, we're all prone in different ways. They have other things that they are prone to as well. So number 2 is genetics, and then depression. You can see how important depression is. Depression is a terrible, terrible, terrible illness, and that can be managed, if not prevented. And then other medical conditions go prone to their risk factors, medical conditions, brain injury, stroke, infection, encephalitis, like meningitis. People have brain infection, viral infections that could affect the brain, distort the whole balance, could lead to problem. Physical activity, you put the weight bar there, absolutely, you cannot overemphasize. We've said that several times here. If you're active, your blood cells, your heart is pumping, you're circulating, you are perfusing your brain, you are perfusing all your muscles and everything, they keep going. If you're less active, it's a problem. And then smoking, we've discussed smoking, alcohol and drug use. And then comorbidity means our underlying medical problems that we have. If you have depending on the list of our comorbidity, that could prone to dementia. And then the body mass index is the weight, which is the weight over the height square, your weight to the square of your height. So body mass index between 20 to 25 is what is acceptable. If you are above 25 body mass index, you are overweight. The farther you go, like you're between 30 and 35, then you become obese. And you become 35 and above, then that is pathological. There's a disease. It's prone to a lot of them. We've discussed that here. Cancer, it can lead to cancer, diabetes, high blood pressure. So BMI is very important. And they talk about 7 stages of dementia. Those are micro stages. We don't need 7 stages. There are 3 stages: the mild one, the moderate, and the severe. I'll just put it that much. So the mild one, you don't even notice. You can go through mild. A lot of people have mild dementia, and they will outsmart it. They'll find a way around it, how to manage it, how to use their calendar very well, their notes very well. They have the support network, they will get away with it. The time you will get to know for not some people is moderate, when it becomes moderate, and then it becoming frictions. You are telling them, I told you this 2 weeks ago, and they're fighting you. I didn't know anything about this. And they start fighting, nope, because they've forgotten. And then so those are the moderate ones. They get by. So the severe one is the one that we see all the time. And that is too late. And there's not much you can do about that. Okay. And then the diagnosis, how do you diagnose dementia? So once you hit the age of 65, and you come to our clinic, Dr. Adetunji and I, we will seize opportunity to do a mental assessment on you, a quick one, without you even knowing. So we do that. But once we suspect there is something going on, then we do a formal assessment. So there are many assessments listed here, which involve mini mental states, abbreviated mental states. So there's a scoring. We can just, give you an address to memorize, and then we'll say, okay, memorize this address, number 42 Ring Road. And you say, okay, can you count backward from 20 down to 1? Just to distract them. You count from 20 to 1. You see how they could link that concentration ability. And then you now ask them, who is the current prime minister? You ask them things like that. Then you now go back, the address I gave you earlier on, can you recall those address? And you'll be shocked how many people could not recall the address that you've given. So when you suspect that, then right, there's a problem going on without even the person. So you now say, okay, let me do a laboratory test. Laboratory test is just to look at reversible causes of dementia. We mentioned vitamin B12, a very essential vitamin for our metabolism, for our function, the brain function. B12, folic acid, very important. So we check your B12 and folic acid. If it's low, give you a lot of B12. And when we give you loading B12, then you get their memory back quickly. So that B12, for instance, and then laboratory tests involve things like venereal disease, syphilis. Syphilis leads to dementia. The problem with syphilis, thank goodness, is no longer like before because of antibiotics. Penicillin got rid of syphilis. In the past, before the advent of antibiotics, a lot of people is attributed to dementia from syphilis. So latent syphilis, that you just check them for VDR and you find out they have syphilis, latent syphilis. And if you treat that, you will cure that dementia at that time. They are just not being treated. It's been there for ages. So we talk about B12, syphilis. Those are the reversible causes. That test that we do in the laboratory to see whether we could get HIV. I should mention that we all kind of downplaying HIV. HIV leads to dementia. So, and the good thing about HIV is just like a cold these days. The only person that will kill himself from HIV is the guy that is not taking his tablets. A lot of people have HIV out there. They take their tablets every day. Fine. Majority will even go to 0. They will not give it to somebody else because they have 0 viral load or negligible viral load, and they function and go okay. So we seize this opportunity as well. It's important to check your status every now and then because you never know. Anything could happen. So yeah, so those are possible causes of dementia that could be dealt with. Treatments, now they've divided treatments into medications and non-drug therapies. The medications available, there are quite a few. Yeah, we're going to that. Next slide, please. Yeah, thank you. Next slide. Yeah, thank you. So just to look at the names of the medication, we can always reference that. There are a few of them. These medications is debatable. Now, some people will say, what is the medication doing? Well, from experience, and it stops the progression of disease because dementia is a progressive decline in the cognitive, is progressive. So once you start the medication, it's not for everybody. You have to assess the patient whether that's the right medication for them. Awful side effects, not everybody will tolerate it. So when you are happy that you want to put them on the medication, you start the treatment and it will stop the decline, which is good. When it stops the decline, then you can consider, we reward ourselves with that. Oh, that's good. So can you say it has really cured dementia? I'll leave you to answer that part. So there are a few options there. If you're not tolerating one, we'll try the other ones and things like that. Can we go back to the previous slide again, Eddie, please? Thank you. Now, the non-drug therapies, you could see those lists behind. We talk about modifying the environment, occupational therapy, and modifying common task therapy. Now, you are getting old, an old man. Well, you nice to talk about the prevalence of dementia. Prevalence is 4%. in over 60, 4%. So out of 100 people, 4 of them will have dementia in over 60-year-old. That's scary. And I'm sure that's an underestimation. If diabetes is about 6, 7% of people, why would dementia be 4%? So I don't think so. And when you look at the studies are not just, it's not global. It's mainly for the people in the Western world. If you go into the African communities and everything like that, I'm sure the prevalence will be higher than that. So 4%. So we now talk about non-drug therapy. It doesn't have to be drug. Now, when you've lived in an environment in the house for like 25 years, you will know the corner and everything, the area where the off licenses, where the newsstand is, where everything is. So you function in that environment, you could get yourself around, you could do your things, you know where your church is, you know your network support. Those things are very important. And it's important for this group because, oh, I've made money, I want to take care of my parents. And you move them away from the suburb, so from the area where they are. You think to you, no, it's not good enough. I'm taking them to a posh area. These people, they struggle, they become frustrated, and they cannot even function. Not all of them, and they become like, goodness, what am I doing here? Because those networks, they're not there, they're supposed. So it's very important that we focus more on the non-drug therapies. I'm even more into that than the drug therapy, because I don't, as far as I'm concerned, I think this is better than even going on drug. So occupational therapy is anything to modify their life to make things better. Yeah, my experience, my dad he has a place to keep his money at home, and people will go out there and steal it every time. Until I bought him a vault, a machine. So I bought the machine, and he's the only one that could access that machine. He will forget the code, and I'll call him, go and put the code in, you have money. Every day he wakes up, which is really sad, but I need to share this. He's in his 90s, and he'll forget that he has money. He wakes up and thinks, I don't have money. I say, you have money. I don't have money. You have money. Okay, go into your place now where you keep your money. You go there and say, I'm very sorry. You know, you understand that we can manage that. It's very mad. His own is not a sinner, it's old age dementia. And then he's fine for the next 2 days or 3 days. And then it happens again. He just think, I don't have money. Money is his problem. I don't know. I wish I could get into the background of that. Why he's always thinking like that. And I said, what do you want to do with this money? He said, I can't do without money. I must have money in my pocket. Okay, so it took a long while, because anytime you give money to him, the money will disappear because somebody else was coming in to steal the money. But we now have a vault, and it's only one of my sister that has access to that vault. Yeah, so I think that's me. Thank you.
Okay, let me just stop sharing.